Welcome to LMDtv. I'm Andrea Melisa. On Talking Business, our focus is on the pharmaceutical sector. Joining Anushan Selvarajah is the Group Managing Director of Sunshine Holdings, Vish Govindasamy.
Welcome to LMDtv, Vish. Good to have you with us.
Thank you very much.
Now, the pharmaceutical sector's experience during this pandemic has been different to other companies. Now, the pharmaceutical sector continued working throughout. Could you just elaborate on this experience, please?
So, pharmaceutical sector was no different from all the other sectors. It's just that it happens to be an essential item. So people need their medicines, people need their, day-to-day things that they need to take. Therefore, we had to make sure that these items were delivered even through the lockdown throughout the country. Similarly, we had to make sure all the government hospitals got all the items that was required, all the testing equipment, laboratory equipment, and also with the greatest difficulty through the lockdown with the permission of the defense, permission of the health ministry, we opened the pharmacies as well. So the effect was the same in terms of difficulty of operating, getting the goods, etc. But because it's an essential service, we owed it to the nation to make sure these things were available throughout. But getting people to come to work, getting the goods from the warehouse to the stores, to the hospitals, etc., was a nightmare. But it created revenue, if that's what you're asking, versus some other sectors, yes. But it was nowhere near how we would have done on a normal month or a normal week or a normal day.
What about moving on to the e-commerce platforms, Vish? How did that work out for you?
Yeah, so our wholesale business doesn't get involved in the e-commerce at all. That is where we distribute to the entire pharmacy chain and the hospitals, etc. That is very much still telephone orders, fax, email, etc. But the last mile, which is from the pharmacy to the patients, was where the e-commerce platform. Did we have a platform? Yes. Was it working? Yes. Did we ever experience the volume? Absolutely no. We were overwhelmed. Unlike a grocery store where you can put anybody, once you get the order, to go to the shelf and pick the products, it doesn't work like that in a pharmacy. We are dealing with someone's lives, someone's child, someone's mother, someone's father. Which means a qualified pharmacist has to read the prescription, make sure the dosage is right, and the product is available. And there's restrictions on substitutions, etc. So we need to talk to the patient, understand if they have allergies, etc., and pack it, and then of course the final delivery part. So yeah, it was not something we experienced it. But did we come out of it? Yes, we came out of it. Initially, it was very difficult, but I think our team did an amazing job, and the platform is working. It did not crash or anything like that. But can we do more? Of course, yes. It was an amazing learning curve. Are we putting money in it? Yes. But what is interesting is the number of orders have just taken a dive. You would have thought that people would get used to this than coming and standing in line to get into the store, but people still prefer that than putting it online and waiting to get it delivered at home.
Vish, you mentioned the wholesale segment. Now, prior to this entire pandemic, the complaint from the pharmaceutical sector was the non-payment of bills by the state sector. Now, what is the impact or the implications of this non-payment, and is there a solution for it?
See, it's again, like I said, we are an essential service. Whether there is payment or not, we can't stop delivery of our products, right? Because we are in the business of saving lives. So we continue to serve. We make continuous lobby to make sure our payments are given. Similarly, with our principals, who supply us the products, we lobby with them, explaining the difficulty that we are having. Unfortunately for Sri Lanka, we had the Easter situation where the government went into a spin, and then then onwards, this was building up. But there was some good made during this pandemic. Some payments did arise because otherwise we would have been just stranded, not being able to make salary, not being able to clear the goods that was in the port to get it to the people. Um, is there a solution? I think, yeah, the solution is there. We have recommended, I'm part of the Ceylon Chamber, we have recommended that the government go into a e-platform for purchasing of pharmaceutical items for the health ministry. This way, there is a very transparent tender process. So this way, they also can read the demand versus supply better. Maybe some stuff they're stocking more than they should. Some are, so depends on, if there's an influenza that's going on, or like this COVID, etc. So they can plan things a lot better, and they can work with the companies. We can work with our principals and agreeing on credit terms, etc. But then the overall economy, that is not something I can do. That's to the people who are running this country. They need to take stock of that.
Which pandemics put countries like ours into a unique situation. When airports and ports across the globe have to shut down because of a health crisis, countries that net import, like Sri Lanka, especially when it comes to medicines, are put in a bit of a pickle. Shouldn't Sri Lanka be thinking about being more self-sufficient when it comes to producing medicines? Yes, our market is small, but there is always a chance of exporting as well. What is your opinion on
I
this?
think that's been around in the last 10 years or so, from this government that's there now, when they were there before, and then the government after. I think there's lots of the budgets had lots of incentives, etc. There were some government buybacks given. See, it's finally every company has to look at investment versus return, right? No company has unlimited resource. Everybody likes to get return. I mean, I work for a public company. Shareholders, end of the day, don't care whether I like manufacturing versus they like their return. So right now, if you look at the people who have gone into manufacturing, it is a challenge. Other than the government buyback, selling it in the private market or exporting is a huge challenge, because you have to understand everything has to be imported other than the labor, from the machinery to the packaging material to the API, which is the raw material. Everything has to be imported, and we have to put it together. Basically, it's like our garment industry, which is putting it together and sending it out. So similar is what we will be doing. Whereas our neighbors, if you look at three giants, Bangladesh, India, and Pakistan, they are, with their population, they have such a huge buying power of buying all these things that I told you, the API, the packing material, everything. I think the State Pharmaceutical Corporation, which has a reasonable setup already, and now they're invested and they're expanding. There are a few other companies who have been there. I think if you really expand those and do a good job, I think that should be fine. The example is, we like to fly planes. Should we be making jet engines? I don't think so, right? Somebody else knows to make jet engines. So we should be in the business of doing the things that we know. I mean, we are very good in garment manufacture, etc. So the answer is not just a yes or no, it's a combination.
We're going for a shorter break now, Vish. Don't go away. We'll be right back after this. Welcome back to the show as we continue our focus on the economic challenges in a pandemic year with the Managing Director of Sunshine Group, Vish Govindasamy. Vish, I'm sure you've kept abreast of all the news surrounding vaccines. There have been a number of names being spouted by various media outlets. But what is your opinion? Is the human race closer to a vaccine? Will we see one by the end of this year?
I don't want to sound pessimistic. See, the last time that we had not a pandemic, but a huge virus, which is the HIV/AIDS, so many millions, billions have been put by so many countries. So far, there isn't a vaccine. The last big vaccine was the influenza vaccine, which is again a viral vaccine, which is now in the last, I would say, 5-10 years, it's being used heavily in the Western world. I don't think it's used in the Eastern world yet. Maybe a few who have. Even if you take dengue vaccine, right? Dengue vaccine is not proved to be safe, right? So far, it's not proved to be safe. They have put a lot of restrictions. It has to be given above 9 years, below 40 years, in 3 doses, etc. But then, this is different. This whole social distancing, coming from droplets, etc. There'll be a huge effort in making this vaccine. But on the picking list, we will be last in the picking list by the time we get it here. By then, I think like everything else, we will probably learn how to live with it. And because we have learned how to live with a common cold, right? It's a viral, common cold is a viral. We have all learned how to live with it, how to take care of it. We will learn how to be more immune to these things. So I'm not very optimistic that this can be done so quickly. Because a live vaccine can react in so many different ways on the human body.
Now, Vish, another topic making the rounds on social media is whether countries will be prepared for the next pandemic or the next health crisis. Let's talk about Sri Lanka. For Sri Lanka to be prepared, what sort of policies do you think need to be brought in?
I think more than anything, our healthcare sector needs to significantly, I think, invested and improved. Even though we have, if you look around the rest of our countries that are around, our healthcare system is one of the best in terms of providing free health for the entire population. You, me, everybody can go there and get our medicine. But unfortunately, because of bureaucracy, etc., a lot of attention has not been paid. We have only 500 ICU beds in the government sector. So a lot of that needs to be improved. When I say it's easier said, it all means money, right? End of the day, it just translates to money. Where does money come from? Government revenue. Government revenue comes from taxes. So all this needs to be worked. Our export industry needs to do better so that we have revenue coming in. There's no doubt the one way to be prepared, and I think we did a decent job, even though we were probably not 100% prepared, we did a decent job in managing and saving lives. I must congratulate everybody who was involved in making this happen. You and I are safe today. But to go forward, we have to be that much more ready in terms of our healthcare investments. So we need more hospital beds, we need more doctors, we need more specialists, we need more. We are very lucky we had an ambulance system that was donated by India, the 1990 ambulance. That was used heavily during this pandemic. Just imagine if it was not there, what would have happened? So all those, so those are all things of being prepared.
What are your views on the pharma sector joining up or linking up with our universities? Now, we have some of the brightest minds within our universities. So, wouldn't that be beneficial for the industry to use that intelligence and maybe take this industry up to the next level?
There's nothing wrong in the pharmaceutical industry working with the local graduates and universities and the professors in upgrading our system. how we deliver the medicine to the people or how the patients. I mean, look, today, pandemic has allowed people to talk to a doctor online. There are so many different opportunities now, right? So during these 2 months, so many people were able to talk to a doctor, for their routine problems. Just imagine, it was not that popular 2 months before. So all this will be, anytime there is trouble, inventions happen, right? Who would have thought, you would be having medicines delivered to your door? So all this will happen, and we need to collaborate. You're absolutely right. We need to use our education system, our higher education system. I think there's a nanotechnology center. So many things are available. We need to collaborate.
Finally, Vish, how do you see the pharmaceutical sector performing over the next 6 months?
I think it's an uphill task. What we don't know now is all the products that we had, all the companies basically had stock. That's usually the pattern. We normally carry 3-4 months worth of stock. Having India, Pakistan being shut down, and India has really not come back to work. Even though they were supposed to come back to work this week, they haven't really come back to work. By the time they get their supplies ready, and China has not supplied API to them, so it'll be a challenge to see if we can get our next 6 months products the way we want. Once we get the products here, delivering is not an issue at all. So that will be the next 6 months will be more uphill than this first 6 months.
Thank you for joining us on the show, Vish. It was a pleasure.
Thank you very much for having me on the show.
Andrea Melisa will be up next after a short break with an update on business confidence and the economy. Stay tuned.
Welcome back to the show. I'm Andrea Melisa. Now we'll take a look at the latest LMD Nielsen Business Confidence Index and the economy. Global rating agencies have downgraded Sri Lanka amid concerns over fiscal policy, while the COVID-19 pandemic threatens to reverse the growth curve. In contrast, the latest LMD Nielsen Business Confidence Index, while falling marginally, may offer a degree of hope. The BCI dropped further in May from the previous month's 93 to a lowly 89. Nevertheless, this represents a less sharp decline than in April, when the index plummeted by as many as 52 basis points compared to the prior month. Intriguingly, the barometer is still higher than where it was in the immediate aftermath of the Easter Sunday attacks, that is 62 basis points in May last year. Overshadowing issues such as inflation, the value of the rupee, and high taxes, the impact of the coronavirus emerges as the most telling sensitivity when it comes to business in the country today. According to those consulted in the BCI survey, the main national concern also refers to the spread of COVID-19, followed by the economy and the adverse impact on daily wage earners. Sentiment is seemingly beginning to hold, with a number of corporates voicing cautious optimism regarding the future of their businesses, provided, of course, that the virus doesn't make a comeback and lead to an extended lockdown. Moving on to the economy, with the country looking to gear itself up to reopen, 36% compared to 33% in April of the business people consulted in the latest BCI survey state that the economy will improve in the next 6 months. What's more, the share of respondents stating that economic conditions will deteriorate during this period has declined to 41% from 62% in the previous month. Corporate executives seem more optimistic where business prospects are concerned, with nearly 6 in 10 respondents versus 44% in April anticipating sales volumes to increase in the 12 months ahead. There's also a greater expectation of business improving in the next 3 months, as indicated by almost a third, up from 13% in the prior month of the sample. A similar number of respondents feel that sales volumes will stay the same or get worse, respectively. Sentiment regarding the investment climate has weakened further, with a mere 9% of business people feeling that it is a good time to invest in the country. Corporates are largely looking to maintain their employee count in the 6 months ahead, according to at least 8 out of 10 respondents, compared to 69% in April. Well, that's our show for this week. Don't forget to subscribe to our YouTube channel and follow us on Facebook. Thank you for watching LMDtv. Stay safe.